and welcome to Chico Unscripted. Today's episode, we're going to be talking about medical diagnostics. What is a medical diagnostics lab? What is the importance of a lab within the general healthcare system? How a lab functions inside of a hospital. I'm sure many of you, every time you go to the hospital and the doctor says, go to the lab, either go for a blood test, a urine test, or any other type of fluids that you have to give them, you don't really know what happens after that. However, today we're going to get that insight into what is a medical diagnostics lab within the general healthcare system. And also, what are the causes and consequences of misdiagnosis? And do Gambians still need to travel abroad in order for them to get the care that they can have here in the Gambia? Those are the topics that we're going to cover today. And so I want to introduce to you doctors, medical scientists, and a company that has set itself as a goal to transform the healthcare sector here in the Gambia. Follow me, let's discover what is medical diagnostics.
So I'm Dr. Kebba S. Marena. I'm an orthopedic surgeon and I am the medical director of Jaama Specialty Hospital. Jaama is 4 consultants coming together, Dr. Jaite, Dr. Jaama, and Dr. Marena, hence the Jaama, 3 J's and an M. And we are 3 consultants over the top of our fields in various areas. And what we wanted to do was have a private facility that was able to offer the best of care, sort of a one-stop shop where you can come in and have everything done in a single place, where we would also try and offer a quality that we felt was not available elsewhere. Because everything that we have done to date in our government jobs, for example, has really shown that we can bring that sort of quality. And we want to be able to replicate that in a system where there are less restrictions. Because in our other jobs, there's only so high you can go with some ceilings. And in the private setting, the ceilings really aren't there, apart from being financial. It's just trying to see what you can provide and to give the best services to Gambian people. So again, to try and stop you from having to go abroad for certain services that they can get here and build that confidence. Because even though we have a private sector, people still will go abroad to have things done because the confidence isn't there. They don't feel that we have that number of specialists that can cover everything. And we want to show that that is possible here. So first, I start with what we have. The 4 founders are myself, orthopedic surgeon. We have a cardiologist. We have a neurosurgeon, and we have a general surgeon who has an oncology specialist, or specialist in cancer. We also have a maternity department with obstetrics. We have a hematologist. We have a nephrologist. We have a urologist. We have infectious disease specialists. I'm sure I'm missing some, but I hope it's not. There are quite a few, and we're continuing to build. We have a pediatric surgeon. We have pediatricians, people that do infant welfare, and also we have radiologists who do some scans and do some reporting for us. So we're trying to continue to grow our family, as we call it, to try and include everything possible. And almost all the specialties that I'm mentioning are all Gambian. So that's another pride for us. It's trying to bring the best of Gambian to people. The reasons why people go abroad, I think, often are mostly historic, because there has been a sort of lack of confidence in the health service and what the health service has been able to provide in the past. And people still stay with that mindset, thinking that it hasn't improved. And the other thing is that a lot of places, I think, also still work in silos in a way. So previously where I would work, you would say, if you want to have a good orthopedic surgeon, you would go there. And the question is, do they have a good anesthesiologist? Do they have a good, X and Y? So often you feel that, yes, I can get good care with this here and I can get good care of that there, but I can't get good combined care. And that's what we want to change, because we think that is part of the reason why people go elsewhere. If you see videos of people who've gone abroad, they'll tell you, I saw the best of this, I had the best of that, and I had a good package altogether. And that's what we want. The reason I feel we can offer the best care is part of in who the founders are. I think that brings the confidence that allows us to get some of the best staff. So we get applications from a lot of people because they've either worked with us previously or they've heard of the reputation. And when you hear that 4 of these people with this sort of reputation have come together, you expect that what they're going to produce is going to be quality. So that draws in the other people too. I think that's how we've been able to get other specialists come to work with us. Our nursing staff, we're hoping to get some of the best people join us. And I think that's what is going to build the brand and the confidence.
I am Mouctar. I am the branch manager of AQA Jaama. So we are the AQA branch, which is located at Jaama Specialty Hospital. Our main goal here is to conduct some laboratory tests to fast the turnaround time for the patients. What we do here basically is a blood count test and basic electrolyte and some inflammatory markers. So the most complex test, we collect samples and transport them to our main branch at Kanifing. Yeah, that's what we do here. The results of the lab, it's personnel. So it's personnel. We have competent individuals here. The list, almost all the employees have BSc. We have master's degree holders and BSc holders. So we run daily quality controls to make sure these quality controls are from the manufacturer. So we make sure we run quality controls that values are already known. So this way, we will be able to tell whether the quality of the results that we are giving out. So we have done daily calibration and daily quality control checks.
So I think it's to make sure that this is not happening, that the misdiagnoses aren't happening. What we need to do is make sure the clinicians are also very well trained. So that's the first part of it. If you're trained, you learn to pick up some patterns that lead you to some diagnoses, but you also learn what tests you need to do. So a lot of it comes back to the training of the clinicians. But then even when you have a very highly trained clinician, there are limitations to what they can do without the diagnostics. I think that's where places like AQA have come in for most of us. And we've built a working relationship with them because we've often come in, you've had a clinical question that you haven't been able to answer for some time. I think a lot of my patients, to give an example of myself, have rheumatoid arthritis, for example. For a long time, I could never do a test that could prove that they had it. I would treat them with the medication and they'd get better, and I say, well, I assume it was rheumatoid because they got better, but I couldn't say for sure you definitely had it. Until the time came where AQA started doing the test for rheumatoid arthritis, and I would be able to send them to the lab. They'd come back with a result, and I'd look at it and say, yes, the lab confirms that you have this. So we were treating it right, but at least now you know what it is. I mean, personally, I was trained in the UK, where I had every resource available at no cost to the patient. And it was a complete switch coming here where it was almost the opposite, where you knew what you wanted to do for the patient, but often it wasn't available. And I mean, as an orthopedic surgeon, that often was to do with operations and materials and things like that. But yes, to some extent, diagnostics too. But that was a common frustration. But again, depending on your training, it then allows you to improvise it. I think that's what most of us tend to do here, it's improvising. So there is always that frustration that you could be doing better, you could be giving them better, and you know how to do better, but you're just not able to, which is, it is frustrating. But still, I would say that depending on training, you are able to still give a good quality of care. But it's that also, that little bit that's lacking, that will make somebody want to go abroad, because they think, well, I know he can do it, but I would have this much better care if I went somewhere else. And that is a frustration often, when we see people that we know we can treat choosing to go elsewhere just because of the environment around what we do.
Okay, we are happy to work with AQA. Number one is because of the reliability of the results, because the trust that we have in their results. And compared to others, we observe that, okay, sometimes if you have a doubt and you send to them, most of the time we have, sometimes we have this confidence on them now. That's a good laboratory, and many are sending there. The laboratory, so not only Africmed, many people are sending their patient there to do some lab tests. So that's why we are happy to work with them, because of the results that we are having.
Yes, I came to know about AQA from one of my colleagues when initially you people have started. So after that one, then we was here. We used to send our patients. Before that one, we was facing some problems. The problem was that one it was quality. The results was not some of the labs when we are sending outside, we were not satisfied with that one. So currently, for example, when we have visited myself and our team, and after that one, when we have seen the procedures and the quality over there, quality controls over there, all is according to the standard. So they are following the ISO standards and the some European and American standards, so which are good, and giving us a proper put a proper diagnosis for our patients. See, previously our laboratory is very limited. We are doing basic tests, baseline, just like hematology. We are doing biochemistry, some of the tests, and we are doing some rapid tests. But now, even sometime if I am in doubt with my own laboratory, I used to send same sample to the AQA also, to check my quality also, the hospital quality, whether my staff is doing proper also. Though to improve our quality, AQA also, they told us that they will come, and they used to come, and they will check our quality also for the basic and that test also. But what we have faced previously also, some hormonal tests, some rare tests what we are not doing, we used to send and give to the referral to the patient. Now since we are collaborating with the AQA, we are sending from here the test, the same day or next day we are getting the results, and it is making us, not only us, even my patients, they are comfortable with that one. Is easy, and my mind is also clear that one, yes, what we are doing is a normal, and it is good. You know, previously in the town only MRC they were standard, so now we are happy. At least sometime MRC they are working for their own patients and research base also. They used to do the for us also, but now we have a good partner where we can send anytime and we can get the result, proper result. So that is what we are feeling over here. We are very lucky that you people are around, you are working good, and after visiting your place also, what I have seen, I'm satisfied with the results also, and the quality also, and the other aspects of the diagnosis also, what we people are providing.
So what we want to provide for Gambia is, as I said, giving that environment so that if you walk into Jaama as a hospital, that you're not going to feel that because you're in Gambia, you are getting somewhat substandard care. That the instruments that you see being used, you know that you would get elsewhere. The level of the doctor that you care from the doctors and the nurses is also at a level that you'd expect elsewhere. And that was the reason also why we went into partnership with AQA, because we looked around and we thought, yes, we could possibly look at getting our own lab and trying to manage it. But we all know where we send our lab tests to, and the reason we send it there is the confidence in this lab, AQA, because of the fact that they are dedicated to excellence. And our tagline is healing with care and excellence. And they just tie in together. The values that we have are very similar to what the values of AQA is, making sure that Gambians get best care, get a varied the types of care, and also making sure that we're committed to making sure the care is excellent. Another thing we actually didn't touch on about misdiagnosis is the fact that not just not having the test, but sometimes not being able to rely on the result. And that's one thing that we don't have with AQA. Wherever we've been in the past, whenever you had a test that just didn't feel right, we would say run it again at AQA because we would trust that result. And it's that quality of care that's also very important, not just the amount of different tests you can do. It's making sure you have that eye for quality and that dedication to producing quality.
Opening a lab, it's easy, but providing the quality of service is the main goal. So now, if you open a lab can be run by anybody. But now the goal is to provide the real quality of service. But with AQA, we've proven time and time that there is always a quality of service in that with our results. That's why most doctors are referring their patients to AQA, not because they have a bond with them, but because the quality of service they're receiving from the results that have been produced. So I will put it to them that AQA is a quality laboratory, and it's best for them to go with AQA because their quality has already been established. It has already been proven than them starting up a new laboratory, which is going to take time to catch up with quality.
For us, it was very nice to have, let's say, a lab that we could rely on and to be able to have this partnership. We sat down the same way we got the four of us together, be able to sit with people from AQA, and it was a shared vision. When we talked about what we wanted, across the table they're saying to us, this is what we are trying to provide as well. So it was almost a match made in heaven, as you would say, because it eliminates us having to try and replicate something that somebody else is already doing very, very well. And it's just bringing them into the fold to make sure that together we provide that excellence.